Hi guys, this is Alicia with Good Morning Sunshine. So today we're going to talk about arthropods and our last clinical pathology lecture that's on exam 3. We also had bacteriology today, but that's on the next exam, and I usually don't talk about that. So we got into phylum Arthropoda. So we have class of Insecta and also class of Arachnida. So we're going to go over in general, those are fleas and lice and flies. And then in the Arachnida, it's also ticks and mites. So we're going to start off with insects versus ticks and mice. So insects have 3 body parts. They have a head, a thorax, and an abdomen. Whereas ticks and mites, they have 2 body parts known as the gnathlosoma and the idiosoma. Insects have 6 legs, so 3 pairs, and then ticks and mites have, as adults and nymphs, they have 8 legs, so 4 pairs, but as larvae, they have 6 legs. Life stages for insects, they go from an egg stage to a larval stage, and a pupa stage and an adult stage, whereas ticks and mites just go through an egg stage, a larva, a nymph, and then to the adult stage here. So starting with insects and ascarans, so from the class Ascara, both groups contain important disease vectors. So we have, for the digestive tract, they have salivary glands, often harbor pathogens. They have a good respiratory system, oxygen diffusion through openings called the spiracles, sometimes used. And then their nervous system is neuromuscular system, most common target of pesticides, and it shares similarities with vertebrates. So the class Insecta, so it's morphology. The adults have 6 legs. They have 3 body segments, so the head, the thorax, and the abdomen. Their life cycle has to do with metamorphosis. So they can either have a single or incomplete life cycle, or they can have a complex or complete life cycle. So the simple life cycle, the larva looks like a small adult. So it's just growing in size basically, whereas a complex life cycle, they have marked differences in morphology and structural between adults and the larvae. So complex, they have an egg, a larval, and adult stage. Instead of with the simple, you just have, they look similar, but only change in size. So the order, we have Symphonoptera, also known as fleas. They're macroscopic, they're usually brown. They're wingless, so they usually just jump. They're laterally compressed, and they have complex metamorphosis. So that's their life cycle. So they go from a flea egg to a flea larvae to a flea pupae to an adult flea. So the parasite called the Tenocephalitis felis. This is the most common flea in the world, actually. So, and only the adults here are parasitic. The host being dogs, cats, ferrets, and occasionally other animals. So it's the most common fleas of cats and dogs, though, however. So 2 other species occasionally found on small animals, but is much less common. These are worldwide. They have immature stages in the environment, so they prefer high humidity and warm temperatures and don't survive in freezing temperatures. Their life cycle, so once on a host, the adults are considered permanent ectoparasites, so the females begin feeding as soon as they find a host. Then they mate and begin laying eggs after 24 hours, so they have to wait 24 hours before they actually start laying eggs. So one female can lay up to 1,000 eggs, although most females don't live long enough to do this, but they can get there. The eggs are about 0.5 millimeters laid on the host, but they fall off. They usually hatch in a few days, up to 6 days. They have to do with warm and humid conditions, so nearly all eggs hatch because the humans provide this warm, humid environment. The larvae is slender. They're white. They're 2 to 5 millimeters. They may have a dark appearance from the blood in the intestine. They eat organic debris, but requires flea feces, so limited movement, and they love high humidity. The pupa stage, the larvae form sticky cocoon debris sticks, so they usually start camouflage. The adult can stay in the pupa for up to 6 months, and it's the tough stage because they're not killed by pesticides. So they have a minimum life cycle, so it requires perfect conditions. So 2 weeks is their minimum life cycle. Actually, 95% of their life cycle is hidden from us. We only see the adult stage, so that's only 5%. They're in a flea pupae stage, that's 10% of the infection. The flea larvae stage is 35%, and the flea eggs are 50%. So the diagnosis is usually diagnosed by observation. So adults flea, dirt, or scratching, and it may be hard to convince clients that fleas are actually present. The clinical importance, we have hypersensitivity reaction to the flea saliva antigens, this leading to flea allergy dermatitis, also known as FAD. It has a range of pruritus and hair loss from animals that show no evidence of fleas to severe hypersensitivity. Other consequences of this infection is a possible cause of hotspots is the vector of tapeworms. So Diplydia caninum is the treatment for heartworm. It's toxic. So also these fleas look like Acanthochilanemia recondite. These are non-pathogenic, however, so we have to be able, since they look similar, we have to be able to decipher between the non-pathogenic, which was that big word I just said, or if it's actually a flea that is pathogenic here. Other hosts, they can adapt to other hosts under some circumstances. This is serious infestations reported in confined calves and goats. They originate from heavy contamination from barn cats. Humans, they can bite humans. Humans don't sustain their life cycle, however, but if they need a blood meal, they will bite humans. They have possible severe hypersensitivity, and treating animals with products with repellent activity may increase human bites temporarily. Other flea species, fleas are generally species specific, so rodent fleas, we have several species. Will bite dogs, cats if they go on them. They are a vector of Yersinia pestis, also known as plague. Strictite flea, also known, is usually a bird parasite, so sometimes on dogs and cats, but female flea stays attached in this case. Now going to the order of lice, so our Pithoraptoria, they have similar cross-host characteristics. They're small, they're wingless, they're dorso-ventrally flattened, so that makes them different from fleas. They're often white or gray, and some are brown, and can be seen with the naked eye. There's two types of lice. We don't need to know their names, but one is Anopleura. This is our sucking lice, so only in mammals and feed on blood. Then we have our Malophaga, which are our chewing, biting lice, and they're on mammals and birds. They're very host-specific. Geographic distributions worldwide on hosts. The sucking lice need a very thin mouth part, and then the bigger, the ones with the bigger head are our chewing, biting lice. The life cycle for fleas and flies, like I said, they go from eggs to a larval stage, to a second larval stage, to a third larval stage, and then they become a pupa, and then they become an adult. So fleas and flies, that was our flea life cycle. Anyways, so the lice life cycle, all life stages are on the host, so all are parasitic, so the entire life cycle is spent on the host. The eggs are glued to the feathers or hairs. The life cycle is generally about 4 weeks. The lice transmission is not from the environment, so there's no life stage in the environment, so the transmission is by direct contact only or by fomites. It's very host specific. It's usually site specific as well. Lice cannot survive long off the host, so chewing, biting lice may survive several days if cool and humid. Lice populations increase in winter on animals that are kept outside. Their hair, coat, and body temperatures are favorable. That's why they go onto these animals, because it's very cold outside. So more close contact, maybe more stress, nutritional, and weather. We can have carrier animals, stressed animals, most susceptible to heavy louse burdens. The diagnosis of lice, we have the observation of lice in eggs, the pre-dilection sites, the presence of clinical signs, pruritus, and hair loss and poor hair coat. Lice other effects, so in severe cases, they can have anemia, debilitation. Also disease vector but that's insignificant in the U.S. Its clinical importance, infestations generally are not severe in healthy animals, so small animals are uncommon and well cared for pets. Also, if your pet's on heart guard, that usually protects them against this. Horses are uncommon but easily introduced and easily spread. Food animals, it's common. For birds, wild birds are common. For pets, it's very uncommon, more in poultry. For wild mammals, it's common, and it's not zoonotic. Lice treatment, we want to do physical removal. Self-grooming removes lots of lice. Social grooming and other grooming. Adults are not hard to kill. Drugs do not kill their legs, however. The environment, we want to clean potential fomites as possible. And then we have human lice, so Pediculus, this is our head and body louse. We have body louse transmits typhus. And then we have our Pithurus, which is our pubic louse. And that's transmitted sexually. So again, flea and lice compared. So body for fleas is laterally compressed. For lice, it's dorsal ventrally compressed. The legs are adapted for jumping and running for fleas, but grasping and walking for lice. Host specificity, it's broad in fleas, but narrow in lice. Parasitic as adults only in fleas, but all stages of lice are parasitic. For their eggs, they fall off the host in fleas, but stick to hairs for lice. Immature stages, it's larvae in fleas, but nymphs in live. For metamorphosis, in fleas, it's complete. For lice, it's incomplete. So that was the end of arthropods for parasitology lecture today. And then we had ClinPath 18, which we talked about secretional metabolic acidosis. So when the total CO2 is decreased, when the chloride is increased, and the anion gap is normal, this is when we have secretional metabolic acidosis. So diseases and conditions, we have bicarbonate is lost in sequestration in the duodenum and kidneys. The serum biochemistry, we would see a decreased TCO2 and an increased chloride versus sodium. So here is a thing we looked at, a case we looked at. So here we have cations and anions have to be in balance. So here we have losing total CO2. There's no change in the anion gap, so that's normal. So we need to add a negative ion, that being chloride. So this increases chloride. So then it becomes disproportional to the sodium. So here we would think secretional metabolic acidosis. We also want to check pH of the urine, and we want to consider GI loss, so diarrhea in this case. So then we looked at another one. So here we have high potassium and low total CO2 and high anion gap. This would make us think of metabolic titration acidosis, but again, we would check urine and the pH and think of CLU. Those are our ketones and other things. So now getting into metabolic alkalosis, this is when hydrogen ions are too low. So here our total CO2 is increased, our Cl, so our chloride is decreased, but we have a normal anion gap. So diseases and conditions that cause this are stomach and abomasum, so primary respiratory acidosis, hypokalemia, and bicarbonate administration. So on serum biochemistry, we would see an increase in total CO2 and a decrease in chloride versus sodium. So here we're adding bicarb to the system, so we have an excess amount of bicarb. This causes increase in TCO2, so we have to decrease chloride in order to keep the balance, and the anion gap is normal. So how does this happen? So we have a loss in basically GI fluids is usually the main cause. Metabolic alkalosis having to do with the stomach and abomasum. These include vomiting and diarrhea, gastric outflow obstruction, gastric dilation volvulus, displaced abomasum, proximal ileus, causing proximal enteritis and uremia. And then here, so it secretes chloride ions and hydrogen ions, the net accumulation of bicarb. This makes everything alkalose. So no net effect on the blood pH. This goes away from when vomiting happens, so there's a bunch of extra bicarbonate, and the total CO2 will go up in this case. So we're going to think of vomiting and gastric reflux. So now getting into urine pH. So herbivores are alkaline, so that means they're greater than 7. And carnivores are acidic for their urine, so they're less than 7. Metabolic acid-base status, so it mimics the change in serum to TCO2. Total CO2 and urine pH mismatch. So prior acid-base status, urease producing bacteria, so the pH increases, and delayed urine analysis, pH also increases. We have a paradoxical aciduria. It's a classic disorder when the pH and urine pH do not match. So animals will not get better if everything is not treated. So we need to treat the hypovolemia, which is known as the animal's dehydrated, our hypokalemia, so they're vomiting and not eating, so that means low potassium. We have hypochloremia, which also has to do with vomiting, means they have low chloride. So we need to fix all of these issues first before the animal can get better. Definition, we have metabolic alkalosis, so that's usually due to vomiting and LDA. We have acid urine, so paradoxical kidneys are making it worse or peeing out more hydrogen ions, so this is actually a vicious cycle. So we can't get rid of this vicious cycle until we treat all those things that I told you about. Disorders and condition, we have gastric or abomasal outflow obstruction and gastric or abomasal atony. So again, the water flows bicarb in pairs with sodium because there's no chloride to bind with, so it's absorbed as a pair, making alkalosis worse, like I said, and potassium is low and less available, so body then spares hydrogen ions, which also makes the alkalosis worse. So this is just the vicious cycle I was talking about, and we have to treat all the other issues in order for everything to be resolved in this case. And then we just went over cases, which I'm not going to confuse you guys with, but those were our lectures for today. We had a third lecture as well, and I'm just waiting to go to integrative session, so we have that at 3. We just have a lot of things going on and a lot of things to study, so the study starts today, and I'll be studying until probably midnight on Sunday, and then we have our exam on Monday. So, but I love you guys, and I hope you guys are having a good Friday.